So this is the October 2021 COVID-19 update. We try and make these to give you current information. So let's start kind of where we are. We're seeing a bit of a reduction in infections in the United States, except in certain areas. Certain areas have COVID infections that are actually higher than before we had the vaccine. And so this is now a pandemic of the unvaccinated. Vaccinated people are very, very rare that any of them are hospitalized. We all know that there are breakthrough infections and that people can get sick, but people who are vaccinated don't end up in the hospital and don't end up dead. You know, they may have some minor illness. So let's talk about what we know today, okay? We know that all three of the vaccines, Moderna, Pfizer, and J&J, are all very effective. There's a little bit of data which favors Moderna, but not enough so that anybody who took Pfizer should worry about it. I mean, we're talking about a couple of percentage points. So all three of them are very effective. If you get both your shots, you will not end up in the hospital, and you won't end up dying from this disease which has ravaged our country and the world. I mean, over 700,000 people have died in the United States. The other thing we also know is that all of these vaccines attenuate over time, which means, you know, on an earlier video a few months ago, we didn't know, like, once you've gotten both your shots, is that going to be kind of it? Like your antibodies are just sort of great for the duration? And it turns out that that's not the case, that after several months, you begin to see a drop-off in the strength of the antibodies in your system. And so what it's turning out to be is this is not a 2-shot regimen, this is a 3-shot regimen. And the CDC has approved booster shots right now just for Pfizer. We expect approval on Moderna to be probably this month. Moderna was just a little bit slower in producing the data that the FDA needs to approve the booster shot, but it's clearly that's going to be, you're going to be able to get a booster. If you did get J&J, I kind of don't know where they are in the queue, but I expect, because the data that they're producing is pretty much the same as Pfizer and Moderna. So if you did get J&J, there will be a booster opportunity coming. So, who is eligible right now, today? Anybody over 65 is eligible for a booster shot. And people who are immunocompromised, in other words, they have some medical condition, that reduces their immune system to fight off infection, is eligible for a booster. And here's the one for us at Amity. If you're in a high-risk profession, if you're working in a congregate setting, so, for most of us at Amity, that means us. We're in a setting where our job is interacting with people. We have new people entering our campuses every day, every week, every month, who some of them have been vaccinated and some of them haven't. We also know that because none of the vaccines will prevent you from getting infected, they will prevent you from the more serious consequences of it. But even somebody who comes into Amity, or just one of your colleagues, who this morning, Brett Kavanaugh sits on the Supreme Court, has a COVID infection, even though he has been vaccinated, and I'm sure that he gets pretty good medical care. Okay, so we know that we are at risk. We are at greater risk than if we were all sitting at home, or if we were working in offices where we're pretty much isolated. So I want to really encourage everybody who watches this video, everybody at Amity, get the booster shot. Now, even though so far the official approval is just for Pfizer. So you've had the Moderna vaccine and you want to get a booster shot, what should you do? Well, there's so much vaccine available now that frankly, a lot of the places who are giving vaccines will give you a booster shot of the Moderna, even though the FDA hasn't approved it. That's your individual decision. I'm not telling you to do that. That's a decision that if you are anxious, and about 4 million people in the United States have had booster shots now, and there are a lot of people who are self-reporting they just went in and got the Moderna booster, even though it hasn't been officially approved yet. I'm one of those because of my age and because I don't want to get sick, okay? No, and I like being in groups. I had one yesterday. The week before that, I had a week-long workshop with people. So I'm doing things where if I'm around somebody who's infected, and probably doesn't know it because most people I'm around have been vaccinated, but I could get infected. And I don't want to get sick, just personal preference. Even I really don't want to get hospitalized or dead. That's very unlikely because I have been vaccinated, but I just don't, I want to avoid any illness and any infection, COVID-19 infection that I can. And I imagine that most of you feel the same way. So if you make a personal decision to go and ask if you can get the Moderna shot now, that's up to you. I'm not recommending it. I'm just saying that a lot of people are doing it. And that it is about 99 and 9/10% certain that within a month that will be the FDA will put their stamp of approval on that. Again, we don't kind of know about Johnson & Johnson yet. And I would kind of wait and see how that rolls out. Although I think most of the people at Amity have either had Pfizer or Moderna. So that's really basically it. For this edition. This is kind of short and sweet. You do know, continue. When I go to the grocery store, I always wear a mask. This morning I had a medical appointment. Of course, they want you to wear a mask, and they're all wearing masks. You notice that when you go into stores now, all the store employees are wearing masks. They're doing it for a reason, because they are in a high-risk profession. The nature of the business is people are coming in all day and they don't know who's been vaccinated and who isn't, and even vaccinated people could be carrying the infection. So act like you're a store employee. You're in it. Because of the work we do, the important work we do, we are at greater risk than many people in the country, and we should act appropriately. So stay safe, stay wearing your mask, avoid big gatherings of people where people are unmasked, even if they're outdoors. We know the Delta variant is just unbelievably contagious, and you could actually go to a concert, be outdoors, and get infected. because you got thousands of people yelling and hollering and unmasked, and it's just a risk you don't need to take. So, you know, indoor dining, now of course the summer's kind of coming to an end, so the outdoor options may be not as available as they were during the kind of long summer we've had. But if you're dining indoors, I would really try and do it in a place where you feel the safety precautions are very high, where the tables are quite a ways apart, and everybody, the waiters are of course all masked, and people are taking all those precautions. Be safe, be well. Let's continue. The pandemic isn't over. The only way we're going to get it over is, of course, if we get everybody in the United States vaccinated. Thank God it looks like we will be able to vaccinate kids very soon. Probably they think now in this month, in October, we may be able to vaccinate children 5 on up, which is awfully good news. I just feel, you know, I don't have young kids anymore, but God, I just think of parents who have these young kids who are scared every day that their child is going to be infected just going through normal activities. So that's another good piece of good news that's coming. And when that is available, if you've got kids or grandkids, you know, get them vaccinated. Let's not have any more severe illnesses or deaths that we can avoid. Thanks, everybody.